One thing that we do at the end of each board meeting is have a virtual walk around of a department or a team. And recently we had a virtual walk around of the health records team, and it's actually really interesting team in terms of the things that they're doing behind the scenes that we may not be aware of. So this team is responsible for making sure all the health information for patients on their records is there available for all the clinicians working in Golden Jubilee, and obviously really important that any medical decisions are based on information that is there, the case histories, etc. of the patients. So there's that vital function, but also they ensure the confidentiality of the records, and they also provide all the information we have about statistics, about how many particular types of operations we're doing, how many particular type of referrals we're doing. So helping with the planning in the Golden Jubilee for the future, but also in the wider NHS and where the information comes from that we see reported in the press, etc. So 3 very important functions stood out to me, and I think the rest of the board. We're really grateful for what this team did during the pandemic. They obviously had to make a big move to agile working, and that meant an accelerated process of removing things from paper-based records and into electronic records, and that's not an easy task. That's something where a lot of attention to detail in terms of the importance of information and whether we need to keep it or whether we need to move it onto electronic format. So quite a large task to deal with in the middle of transitioning to agile working, and it's admirable that they dealt with that really quickly, and they've also had some very good outcomes in terms of some of the agile working practices has increased efficiency, so very pleased to see that. So overall, a big thank you from me and the rest of the board.